Good morning. We are broadcasting live in honor of the Veterans Day coming up on a couple of days from now. All the veterans, men and women who sacrifice so much. And I just learn so much every single day, not just about, like, let's say what they do here at the VA, but just about coworkers and other people. Like Stacey Olson, registered nurse and whole health program manager, just sat down and put the headphones on and said, "Oh my gosh, I have a really small head. I have to get these headphones to fit." So we learned Stacey has a small head.
Well, when she first sat down and told us that she's a yoga instructor, and then she said she was knocking on the door of a specific age, coming up, I thought, I really got to start doing yoga. You look fantastic.
Thank you.
Then I learned that Doreen was called P-head in school because of her head being little. Oh, and chicken legs, too.
And chicken legs,
yeah. So, like I say, I learned so much.
Don't forget doorknob.
Oh, doorknob. Yeah, we still call you that. Stacey, first of all, thank you for your time today. What is the whole health program? And I understand it's relatively new.
It's brand new. So I just started in July. We've had some classes going on for the past year. And the focus of whole health is to really change the conversation with the veteran and start to look at really what matters to them. We are not a disease-focused department. We talk about their values, their mission, their aspirations.
But you have been here, though. You said you started whole health, but you've
Yes.
been here for how long?
2009.
Okay,
At the VA.
All right. So
Yes.
you've got some background in kind of knowing what all those things. I didn't want people to think you just started and then pick this up. This is a new thing that started this summer.
Correct.
Based on experiences that you all have had in dealing with vets.
Yep.
Okay. All right. So you said you're not disease focused. So your focus is?
Our focus is on helping the veterans really live their life to the fullest. So we have them, eventually we'll have health coaches. We're more of a holistic approach. So we look at the entire veteran. We're veteran-centered, patient-driven. The patient really gets to drive their care. So they get to help make the decisions on why their health matters to them.
And I think a lot of times they don't, and people in general don't necessarily know that your health there's a lot of things involved in that, right? It's how you eat, it's your exercise, it's, how you think and all. It's not just the doctors that you see.
Correct. It's everything around you. It could be your surroundings, your personal development, your spirit, your soul. So it's the whole person. Maybe somebody doesn't like to exercise, so we find something else. Maybe they enjoy art, photography.
And you have your family, there's a lot of military in your
Yes.
family. Tell us about that.
So my grandfather was in the Navy, served in World War II on the Pacific side. My father was in the Army, served with Elvis.
He did?
He met Elvis,
Wow.
had dinner with him.
My dad was in basic training at the same time as Elvis, not at the same place, but that was like the huge story when he was in.
And I once went to Graceland. So it's almost like the same thing. Yeah, you did too?
Yeah.
Okay. All right, good.
No, but he met Elvis. That's awesome.
Right. And my uncle served in Vietnam. He was in the Air Force. My other uncle was a Marine. My cousin is currently in the Navy. And my other cousin, Adam Hunter, he's actually from Heartland, is in the Coast Guard right now.
Do they get their care here?
They don't get their care here. My father goes to Beaver Dam Clinic.
Okay.
My Uncle Tom goes up to the Wassa Clinic.
Okay.
But they're all involved in the VA for
They all
healthcare.
get their care in the VA, yes.
Would you say that's because of the family history, one of the reasons that you wanted to be a part of the VA?
Yeah, I feel like being a nurse here and coming here, it's my way of giving back. And I know my dad's really proud that I'm here and
You
often
should be.
brags about it.
Yeah, he should be, absolutely.
You mentioned yoga. I bet most people don't realize that there's a yoga class at the VA.
There's actually 3 yoga classes at the VA currently.
Really? Wow.
Yoga is really good for you. I mean, for the spiritual, for the mental, and physical.
So how did that happen? How did it start?
So it actually started, many years ago. Andy Hendrickson started it, and his focus was really on the PTSD veterans, and then he retired. And then Erin Lovinus took it over and changed the name. It's called Warrior Stance. She is currently deployed to Afghanistan. She's in the Army, so we definitely miss Erin. And then when she transferred, she's down at the San Antonio VA, then I came in and was lucky enough to get the yoga program.
So if someone's listening right now and they're not familiar with whole health or they're interested in it, what should they do?
They can actually just call the Whole Health. I like to call it the Wellness Line, and that would be 414-384-2000, extension 43611.
Is
Okay.
that on the website, the VA's website?
It
The Milwaukee VA's?
should be on the website.
Yeah.
Otherwise, they can also email. It's warriorstance@va.gov.
Okay, we'll put that on our
Mm-hmm.
Facebook page as well. And thank you again for having us here today
Yes.
and kind of helping explain some of the many things that you guys do here at the Milwaukee VA. We really appreciate your time.
Thank you.
Stacy Olson right there. How good
you.
is that? Very good.